Welcome back. Today is World Diabetes Day, a global campaign focusing on diabetes education and awareness. Here to talk with us about this is Dr. Ariane Davis-Simmons, internal medicine and endocrinology specialist at the Doctors Hospital Health System. Good morning and welcome to Bahamas at Sunrise.
Good morning. Thanks for having me.
My mod, anyone tell me that today was a day for blue? I guess blue is for
That is
World Diabetes
me.
Day. I did not get the memo, so next time, right? But thank you for joining us this morning. So tell us, what is diabetes? We hear about this term all the time. We call it sugar, but tell us, what is diabetes?
Yeah, so diabetes is a metabolic disorder where there is just too much sugar or glucose in the blood. This happens for various reasons. It happens because of decreased insulin production. Insulin is the hormone that takes the sugar into the cells, so it can be used as fuel. And also in this condition, you have insulin resistance due to obesity. And with diabetes, you can have complications if sugars are elevated for too long.
So, culturally, it seems like it's something that we just accept. Oh, my Grammy had sugar, my daddy had sugar, I have sugar. That's something in the family. But how prevalent is type 2 diabetes in the Bahamas really?
Yeah, diabetes is very prevalent. It's a increasing epidemic. So 1 in 7 Bahamians have diabetes,
Wow.
and 1 in 3 have prediabetes. And the majority of patients with diabetes will have type 2 diabetes. That's 90%, with 10% having type 1 diabetes, which is the autoimmune form of diabetes.
So what puts a person at risk for developing diabetes?
So when we're talking about type 2 diabetes, the most common form, the most strongest risk factor is obesity. So being overweight or obese, having a family history of diabetes. So if you have one parent with diabetes, you're at an increased risk of about 25%. If you have 2 parents with diabetes, you have a 50% chance of getting it. So having sedentary lifestyle, so not exercising, having other metabolic conditions like high blood pressure, high cholesterol, being Black or Hispanic puts you at risk of having diabetes. And as you age, also the risk goes up. So being over 45 is also another risk factor for type 2 diabetes.
That sounds like there's a lot working against me there. Sounds like we all need to pay attention to our health, our family history, and what we're doing with our bodies. What is the treatment for diabetes right now?
So for diabetes, it is a layered approach. So it is going to be lifestyle. So changing what you eat, limiting the carbs, the juices, the sodas, things that directly impact the blood sugar, getting moving, so exercising. We recommend at least 30 minutes a day of exercise. And then also following up with your doctor and getting the appropriate medications. And then also managing diabetes, so checking your sugars to know if you're at goal, and good self-care to prevent complications of diabetes.
So and I know Sunday was yesterday, a lot of us had Sunday dinner. So you're saying I can't have the 2 scoops of peas and rice and the potato salad and then the other starch and then wash it down with ice cold grape soda? That's not recommended?
No, that's a bit of a sugar overload. So we talk about moderation. So if you have a 9-inch plate, half of it should be green leafy vegetables or low starch vegetables. That's your broccoli, your cauliflower, spinach. And then only a quarter of your plate should be the starch. So you get to choose one.
Just one.
And then the remainder should be protein.
And just tell us quickly, what are some sources of sugar that we don't commonly recognize that we're consuming on a daily basis? I know we think about sweet sugary drinks and we're talking about potato salad, but what are some of the other forms of sugar that we consume that we're not always paying attention to?
Yes. So as you said, starches, so a lot of Bahamians say, okay, I'm eating healthy, I'm having ground provisions, I'm having plantains, things like that, but they're all starch. So that is all broken down into sugar, your corn, your plantain, your cassava, your yams. Not that you can't have those, but you have to remember that is a starch and it's going to impact your blood sugar. So keep those things in moderation. Other sources of sugar, coconut water has a lot of sugar, especially if it's very sweet. Vitamalt. Lots of sugar. So those are kind of the common things.
Definitely very helpful, and we have to be more mindful of these things what we're putting in our bodies and increase our activity, right? So I know that for for World Diabetes Day, Doctors Hospital is putting on an event this month or today. Please tell us a little bit about it.
Yes, so Doctors Hospital is hosting a series of events where they're taking over various grocery stores. And at that event, there is going to be Meet the Experts, so Meet the Doc. You're going to be able to meet nutritionists, diabetes educators, and it's all focusing on the theme of World Diabetes, which is education, diabetes education. So it's teaching the public about what to eat, what not to eat, and how to prevent all the complications of diabetes. There's also going to be health screenings. So on Thursday, they're going to be at Fresh Market Harbor Bay, 4 p.m. to 7. On Friday, they will be at Solomon's Yamacraw, 4 p.m. to 7. And on Saturday, 8 a.m. to 11 a.m., they'll be at Solomon's Supercenter, Old Trail.
Definitely looking forward to those events. Very important, as you said, being educated and making the public aware of what to do, what not to do, and how you can prevent yourself from developing or worsening the disease of diabetes in your life or in someone else in your family's life. Tell us, somebody who may have pre-diabetes, it's in their family, they want to get themselves checked out. Tell us about the care options available at Doctors Hospital for somebody who is diabetic or pre-diabetic.
Yeah, so for those, let's start with the prediabetes. For those who have prediabetes, this is the phase at which you can prevent it from progressing to diabetes. So the management for that focuses on lifestyle. So at this point, you want to meet with a nutritionist. So there's various nutritionists at Doctors Hospital to get a healthy eating plan. And you can also meet with your provider to talk about exercise regimen. For those who already have diabetes, there are primary care doctors who will diagnose the disease and start treatment. For those who have more complicated disease or who are not well controlled, they may get referred to me. I am the diabetes expert and endocrinologist. In terms of those who have obesity and overweight, and that is the main driver of their diabetes, we have a great group at the metabolic clinic, which is, we have a nutritionist, we have a diabetes educator there, and you also have a bariatric surgeon for those who are interested in weight loss surgery.
And Doctors Hospital has it all covered. You get the education, the awareness, the nutrition, the treatment, and so we're so happy that you came on this morning discussing World Diabetes Day, how prevalent it is in our society, what we can do to prevent ourselves from becoming unhealthy or allowing that pre-diabetes to progress. So I'd like to thank you again this morning, Dr. Ariane Davis-Simmons, for coming on the show, talking to us about World Diabetes Day. We appreciate your time and your knowledge.
Thanks for having me.
You're watching Mamas at Sunrise. We'll be right back.